So you mentioned healthcare, and health is, of course, the focus of the George Institute's activities. The biggest story at the moment is the Ebola crisis in Africa. And a few weeks ago, you wrote in the Washington Post that the Ebola crisis comes less from the virus itself and more from the deadly and misinformed biases that led to a disastrously inadequate response, which are strong words. It's a few weeks on now. How would you characterise the response today? Have we made any progress such that we're now equal to the challenge?
Well, I think the progress, even in the last few days, has been tremendous. So the U.S. commitment was extremely welcome, and I think it's going to be very, very helpful. I was just as I was getting on the plane to come here, I was on a phone call with the Secretary General and many of the leaders of the UN agencies, and we talked about really pushing the envelope, and meaning that there will be missions now. And so, in other words, the Secretary General is handling Ebola as if it were sort of an outbreak of war, where instead of sending peacekeeping troops, we're going to send in people who are going to be battling Ebola. I think the notion that it's going to go to the Security Council, that it's a really security threat, is also very helpful. We found that during the AIDS, the early part of the AIDS epidemic, when we were just beginning to think about treatment, that really helped, the Security Council taking on AIDS. But I think that at some point we're going to look back and have to ask this question: why did we wait so long? Right now, the focus has to be on getting the implementation, getting the people on board, getting the equipment, getting the drugs. Part of it was that I think people felt that being able to do management of electrolytes, being able to do intravenous hydration, that this was just too difficult. And it was very frustrating for me, because I spent most of my adult life trying to convince people that no, you can do very complicated things. And we've been able to do things like drug-resistant TB treatment and HIV treatment. And we had, in my own career and with Partners in Health, our role has been to say, no, it's not too complicated. In fact, you can do this very effectively using community health workers and nurses. And so I was a little surprised that's, again, what we had to do. We had to make the case that we've got to increase the complexity of our intervention, and if we do, we can really decrease the mortality rate. So we at the World Bank Group, they started asking some questions. So what is going to be the impact of the Ebola crisis, and what's going to be the impact economically? And then when we looked at SARS and H1N1, what we found is that 80 to 90% of the economic impact was not because of the people who were sick with the virus. It was because of what we call the aversion behavior as a result of fear around the virus. And so in Liberia, Sierra Leone, and Guinea as well, that's what we expect. So if we get treatment facilities in place, if we get infection control procedures in place that will cover the entire population, it almost doesn't matter how many people are infected. What matters is if our ability to treat and prevent is equal to the number of people who are there. So if we get that in place, then what's going to happen is that people are not going to run away from authority anymore. People are going to be much more likely to go back to the fields, go back to the mines, get back to work. And then if we can get that to the point where the number of cases is not overrunning our ability to respond, then I think we can really eliminate almost 80 to 90% of the economic impact. But that means we have to move really, really quickly. So I've been on the phone with teams in the field. What does this mean? It means we've got to get things like oral rehydration to everybody. We've got to get intravenous IV hydration to just about everywhere, even in the villages. And we've got to be able to monitor electrolytes. And if we do that, we have no idea what the survival rate is. The Ebola virus has never run into a modern first world healthcare system. It's never happened. And our own sense is that if you get those pretty fundamental basic things in place, that we can have a very high survival rate. If you have a high survival rate, if you're preventing new infections, and you have enough in place for everyone, then the whole narrative around this disease changes. And we have a very small window to get that done. Our hope is that with all the efforts now, that we can do it in the next 4 to 6 months. if we don't do it in the next 4 to 6 months and it spreads to 15 countries and 22 countries, the impact could be just absolutely frightening.
That's a scary concept to think about. The human toll of Ebola is obviously absolutely terrible with huge mortality and morbidity rates. What about the economic costs? What's your best estimate of the economic costs of the virus?
So just for 2014, to the end of the year, the 3 countries, Liberia, Sierra Leone, and Guinea, will lose about $360 million of their GDP, which is a significant amount because they're small economies. But if you look at future impacts, if you look at 2015, if we get all the response in place so that we're preventing and we're treating everybody in those 3 countries, then the loss of GDP in 2015 is going to be around $90 million. But if we don't get those in place, the loss of GDP is going to be over $800 million. So, fully an 8 to 10-fold increase in the economic impact, depending on how quickly we get those services in place. So, again, our hope is that we do it. Now, if we don't get those services in place and we start seeing outbreaks in neighboring countries, in Nigeria and Ghana and Senegal, then the numbers could get very high, well into the many, many billions of dollars. So, the great news is that there's the single intervention, getting treatment and prevention services in place, is the effective response to the contagion related to the virus, and it's also the effective response to the contagion related to the fear and aversion behavior that happens if that treatment's not in place. This is pretty simple. This is not about, it's really not about finding a new drug, right? It's very simple. You detect the cases, you prevent the infections, and this is not through some sort of, space age intervention. Any hospital in Australia could prevent the spread of Ebola as a matter of routine. It's universal precautions. Most of the hospitals in developed countries utilize universal precautions. If everyone used universal precautions, there would be no spread of Ebola. So we just, the frustrating thing for me is that people who don't have experience doing clinical interventions in really poor settings, they walk in there wanting to be heroic, and they see how complicated it is, and they walk out saying it's not possible. And that's what we have to stop. We have to stop having amateurs go in and say it's not possible, because we know it is possible. And right now, the good news is that the US government, the World Health Organization, the UN, physicians who I've worked with for years, who have experience with these complex health interventions, are working very closely together and are very close to coming out with a consensus approach that will bring all that complexity to the field.
And Africa seems a very long distance away from Australia, but clearly this is a global issue that we need to deal with. So maybe can I get you to comment on the role that Australia should be playing, and countries like Australia, in addressing the challenges posed by Ebola?
Well, I think it would be great if every country could see this as their own problem. One of the big I think reasons for the long delay is that people kept thinking of Ebola as an African problem or a Liberian problem, and this is just if we do that, for example, if an influenza pandemic breaks out, or if bird flu, or if some form of coronavirus, which was the virus that was responsible for SARS. I think that I hope that we would react differently, but everyone has to understand that Ebola is not something that's just limited to one region or an African problem. It's a human problem, and I think that there's going to be a call for more money. We're going to need more money. We're going to need more health personnel. I think it would be great for every country in the world to participate in some way. Even more important, though, is that every country in the world, especially the developed countries, have to sit back and say, okay, so how can we do this differently next time? Because we're not going to have this kind of time if it's an influenza outbreak, or if it's a much more quickly moving airborne kind of epidemic. I think that we have to admit that there's a long way to go for us to be ready for a severe outbreak like that, that can just move across the globe.